Too small, so we're going to go over here. It's even bigger. Here's my afferent arteriole right here, coming in. It dumps into this thing, which is called the glomerulus. This is now going to start filtering out of the kidney to become urine. This is the glomerulus here. This is the afferent arteriole right here. And it goes to the glomerulus, gets pushed out of here, and whatever stays inside the glomerulus is going to come back through this thing, which is now called an efferent arteriole. Afferent going towards, efferent going away. So here's an afferent arteriole right here. Here's my glomerulus. And then here's my little podocytes. Those are the cells that you see right here. Those are podocytes sitting on there. And then this is an efferent arteriole over here. These are these cells right there. They look different on every one. They're white on this one here. Pod means feet. They have little feet, and they basically cover the afferent arteriole or the glomerulus, and they can let certain fluids in and out. They can control how much fluid. It's like a foot that blocks a hole, so if it really puts its whole foot over the hole, nothing's coming out. So the podocytes can control how much filtrate comes out of the kidney. All right, any questions on that?
Where do crystals form when you get kidney stones?
I'm sorry?
Where do the crystals form when you get kidney stones?
Usually right in the major calyx, in the minor and major calyx. Sometimes they get lodged up here too. You can have kidney stones all throughout. But yeah, you're usually having them in the bladder. So here, yeah, you can have them up in the cortex and the pyramids, right up through the. All right. Let's see. Now we've gone through all the blood. Now we're going to break down Bowman's capsule here. So let's go ahead and turn to.
Dr. B,
Yes.
what about this one here?
I'll get to that later.
Okay.
Do we have to know the capillaries and the glomerulus?
Where are you at? Don't jump. I mean, yeah.
3A.
3A, 3A.
Glomerulus.
Yeah, I'm getting there.
Oh, okay.
Yeah, don't worry. I'm not done with my lecture yet. So. All right, let's go on to the renal corpuscle. That's the next section. That's Bowman's capsule. So all of this is blood flow going through the kidney. Now it's going to be filtered in this section, which is called Bowman's capsule. That's this whole list that you're memorizing here. So it's going to go through the afferent arteriole, the blood is, and then it's going to start exiting out through this blob. It's like the end of your hose. It's got a lot of tangles in it and a lot of holes. Whatever comes out is going to be filtered through the podocytes, and this whole structure right here is now called Bowman's capsule, or it's called the glomerular capsule. So this whole structure, if I tag it, I'm looking for Bowman's capsule. This big blob is the glomerulus. If I put my pointer right in the space there, I'm looking for the word Bowman's space. So afferent arteriole, glomerulus. It gets out of the glomerulus, gets past the podocytes. It's going to now enter into Bowman's space. That filtrate is going to be captured by Bowman's capsule here. And then it's going to continue on to this tube where the pointer is. That is now called the proximal convoluted tubule. Okay? So that takes care of everything that we need to know off of this so far. So now that we've gone here, we are now going to go back to this model right here. So everything's filtered here. Let's go review again. Here's your cortical radiate artery and vein here. Here's my afferent arteriole. Here's my glomerulus. I'm now pointing to this structure right here. This structure is the same as this structure. So this is Bowman's capsule right here. From Bowman's capsule, it's going to now enter this big wiggle area right here. It's all convoluted and turned on itself. This is called the proximal convoluted tubule. Please note that's this thing right here. Please note the proximal convoluted tubule comes directly off of Bowman's capsule. So here is the proximal convoluted tubule. Okay? Now, we're going to do this whole, as we get out of the proximal convoluted tubule, follow the pointer, we have the loop of Henle. That's this whole structure right here, which is called the loop of Henle. However, there are several segments to the loop of Henle. So here's the proximal convoluted tubule, which is in green. And you can see it's very thick right here. So that's the thick segment of the descending limb. It's thick. Thick green. That's the thick segment of the descending limb. As you get a little bit further down, you're now in the thin segment of the descending limb. This is all part of the loop of Henle. So it really is called the thin segment of the descending limb of the loop of Henle. But you can just call it the thick segment of the descending limb, the thin segment of the descending limb, and right here it makes a turn right down here. That is now called the loop of Henle. This is all important for you to learn because you're going to start learning in your lecture class that urine, different parts of urine is filtered out through different sections of the kidney. The thick segment can filter out X percentage and it exchanges fluids and urine. The thin segment has a certain type of exchange. The loop of Henle, there's a certain exchange going on as well here. So this is now the loop of Henle. As we're going up, please note that it's now called the ascending limb, and it's also, this is the thin part of it, so this is the thin segment of the ascending limb. We're now coming up, and you notice that it's gotten a little bit thicker here, and that's called the thick segment of the ascending limb. All right? So just follow along. So that takes care of that, and it's going to dump into this thing, which is now called a collecting duct. All right, let's follow along one more time on this particular model. So what is this capsule called? This is Bowman's capsule, the same thing as this. So this is Bowman's capsule. The first feature that we come to is the proximal convoluted tubule. It comes down, and the thick segment, this is the thick segment of the descending limb here, and then it's the thin segment of the descending limb. What's the actual bottom called? That's called the loop of Henle. And then what happens as it makes the turn up? It's called the thin segment of the ascending limb, and then it gets thicker, which is called the thick segment of the descending limb. And then it starts to get a little twisted through here. That is now called the distal convoluted tubule through here. So after it's the thick segment, it's now called the distal convoluted tubule. However, there is an area where the distal convoluted tubule comes very close to Bowman's capsule. You all see where my pointer is pointing to? That particular area is called the macula densa. It's a very special area. That's where urine, concentrated urine is formed. That's called the macula densa. That's where the distal convoluted tubule comes very close to the Bowman's capsule. You can actually see that happening right here where the pointer is. If you all see the structure that my pointer is touching, that is recognized as the macula densa. From there, after the macula densa, it empties into this structure right here, which is now called a collecting duct. So let's look at this one again. I'm going to review all of this again. So what is this capsule called right here? That's Bowman's capsule. Where is the pointer at now? It's in that space, which is called
glomerulosus.
Space. What is this glob of mess here called?
Glomerulosus.
The glomerulus. What are these cells that have little feet on them called? The podocytes. Good. Once it enters the Bowman's space, it's going to enter this structure, which is the proximal convoluted tubule. Good. Let's go on here. Here's Bowman's capsule, and here's the proximal convoluted tubule right here. Thick segment of the descending limb, thin segment of the descending limb, loop of Henle, thin segment of the ascending limb, thick segment of the ascending limb, coming up through here, which is the distal convoluted tubule. It's come very close to Bowman's capsule. That's the macula densa, and It's the distal convoluted tubule. It's going to dump into this thing, which is called the collecting duct. This area is called the renal pyramid. From the renal pyramid, it goes to the point of the pyramid, which is called the renal papilla. And here at the papilla, it goes into the minor calyx, goes into the major calyx, goes into the pelvis, goes to the ureter, and it's on its way out the body. So this is how urine is formed in the body. All right. There's a few other things I need to talk about. Dang, I'm almost done. Okay, let's go ahead and talk about the paratubular capillary beds and the vasa recta. What's happening here, you see this network right here? Hold on, let's see. I need to make sure I got I'm looking for the word. Cortical nephron versus juxtamedullary. Okay. You see the word cortical nephron versus juxtamedullary nephron. There's a little bit further down. We need to distinguish what a nephron is. A nephron is everything from the loop of Henle, so from Bowman's capsule all the way through the loop of Henle. That is what a nephron is called. That's the filtering unit of the kidney. Everything is called a nephron. If you start blowing your nephrons, you're going to have kidney failure, and you can't. That's why you have to go through dialysis, because you've blown all your kidney nephrons. You notice that this nephron is shorter than this nephron. Can you see the big difference? This one goes not so deep, this one goes really deep. So if they ask you what kind of nephron is this short one right here, that is called a cortical nephron. Cortical because it's only staying within the cortex of the kidney. It's up in the upper cortex of the kidney. This one down here, this big one going really deep, that is called a juxtamedullary nephron. If he asks you what kind of nephron that is, you're going to call that a juxtamedullary nephron. The difference is, the cortical nephron, you have light-colored urine. The juxtamedullary nephron, you have dark urine. If you're really a good drink, if you drink a lot of fluids and you have a healthy kidney, what color is your urine? Is it light or is it dark?
Light.
It's going to be light. You want to have not a bright yellow or a darkish brown, because that means you've got good kidney health. You still have a lot of your cortical nephrons filtering out your kidneys. Have you ever seen an old person in a urinary bag? What color does the urine look like?
It's
Dark brown. Or if you've seen somebody under dialysis, yes?
You said that a nephron was from the loop of Henle to what?
It's basically from the Bowman's capsule, including all of the loop of Henle, until it
Okay.
gets to the collecting duct. That's what enough. You don't have to know that. It's just basically all of the filtering parts of the kidney. So, if you're older though, you notice that these people have dark brown urine because they have no more cortical nephrons. They've blown their kidney. They're in kidney failure. They're relying on these deeper nephrons, the juxtamedullary nephrons, to filter their urine. So their urine is dark brown usually. So that's why you notice that. So if he points to this one, you need to know it's a cortical nephron. If he points to this one, it's a juxtamedullary nephron. There are capillary beds that absorb the fluid of this cortical nephron and one that absorbs the fluid of the juxtamedullary nephron. So if I point to this capillary bed, those are called your paratubular capillaries, or the paratubular capillary bed. That's these things right here. They're reabsorbing the fluid of the cortical nephron here.
The blue and the red.
The blue and the red, that's the paratubular capillary bed. But if you notice this one way down deep, that's working with the juxtamedullary nephron. That is called the vasa recta. These capillaries and veins down through here. So you have the paratubular capillary bed and the vasa recta. Just a couple more things here. We need to talk about the juxtaglomerular apparatus. Yep. All right. See this green looking thing right here on this particular model? This is the distal convoluted tubule. Remember when we talked about the distal convoluted tubule coming close to Bowman's capsule, we called that the macula.